Wrist fractures are a common injury that can occur in a variety of circumstances, and understanding their causes, types, and treatment options is essential for anyone who participates in activities that put stress on the wrist. The wrist is a complex structure composed of multiple bones, tendons, and ligaments, making it susceptible to fractures from falls, sports injuries, and even repetitive motions. Today, I want to dive deep into wrist fractures, particularly focusing on scaphoid fractures, which are among the most frequently encountered injuries in this area. First, let's discuss the types of wrist fractures. They can be classified into several categories, including distal radius fractures, scaphoid fractures, and fractures of the carpal bones. Each type has its own unique characteristics and often requires different approaches for diagnosis and treatment. The scaphoid bone, located near the base of the thumb, is particularly vulnerable. It can be fractured when a person falls onto an outstretched hand, a common occurrence in sports like skateboarding, snowboarding, or even in everyday accidents. When diagnosing a wrist fracture, medical professionals typically begin with a physical examination, assessing for swelling, tenderness, and range of motion. Imaging studies, such as X-rays, are essential for visualizing the fracture. However, scaphoid fractures can sometimes be tricky to detect, as they might not always appear on initial X-rays. In such cases, a doctor may recommend additional imaging techniques, such as MRI or CT scans, to confirm the diagnosis. Once a scaphoid fracture is diagnosed, the treatment approach can vary significantly depending on the fracture's location and severity. Non-surgical treatments are often the first line of defense for stable fractures. These include immobilization with a cast or splint, typically worn for several weeks to allow the bone to heal. The prognosis for non-surgical treatment is generally favorable, with many patients recovering fully. However, it's crucial to follow the prescribed treatment plan closely to avoid complications. If surgical intervention is required, it usually involves the expertise of an orthopedic surgeon, specifically one who specializes in hand and wrist injuries. The surgical procedure may involve the use of screws or plates to stabilize the fractured bone, ensuring proper alignment during the healing process. After surgery, the recovery period can vary, but typically involves wearing a hard cast or a specialized splint to protect the wrist. One effective option for immobilization after a scaphoid fracture is the EXOS long thumb spica with BOA. This type of splint is designed to provide support while allowing for some degree of mobility, which can be beneficial during the recovery phase. The EXOS system is particularly advantageous because of its adjustability and comfort, making it easier for patients to comply with wearing it consistently. In addition to the EXOS splint, there are several other orthopedic supports and splints available on the market. Traditional plaster casts, thermoplastic splints, and custom-molded orthoses are all options that can be tailored to meet the specific needs of the patient. The choice of splint or cast will depend on the fracture's nature, the patient's lifestyle, and the physician's recommendations. Following surgical treatment, rehabilitation plays a crucial role in recovery. Occupational or physical therapy may be necessary to restore strength, flexibility, and function to the wrist. The therapy process can be gradual, starting with gentle range of motion exercises before progressing to more demanding activities. The total recovery time can extend from several weeks to several months, depending on the severity of the fracture and the individual's adherence to the rehabilitation program. It's important to emphasize that even after a successful recovery, there remains a risk of re-injury if proper precautions are not taken. This is particularly relevant for individuals who engage in high-impact sports. Wearing protective gear, such as wrist guards or braces, can significantly reduce the risk of re-injury. For those involved in sports like skateboarding, where falls are common, investing in quality protective equipment is essential. Protective gear and orthopedic supports can be purchased at various sporting goods stores, pharmacies, or online retailers. Many companies offer a wide range of options to suit different sports and activities, ensuring that everyone can find the right fit for their needs. As we conclude this discussion, I want to encourage everyone to practice caution and responsibility when engaging in sports and physical activities. While injuries like wrist fractures can be daunting, understanding their causes, treatment options, and preventive measures can help mitigate risks. Remember, protective gear is not just an accessory. It's a vital part of ensuring your safety and well-being. Lastly, I'd like to disclose that there are affiliate links associated with the resources mentioned in this video. If you choose to use those links, I may earn a small commission at no extra cost to you. Thank you for your support, and I hope this information empowers you to make informed decisions regarding wrist health and safety. Stay safe, stay active, and always prioritize your well-being.